Welcome to A Journey to Whole Woman Health, the podcast where science, mental health, and faith come together to educate, empower, and encourage women in every season of life. We're your hosts, Dr. Jamie Irwin, board-certified OBGYN, and Dr. Mary Catherine Nader, licensed professional counselor with a PhD in counseling. Let's begin the journey. Welcome to A Journey to Whole Woman Health. I am Dr. Jamie Irwin, and I'm a board-certified OBGYN. If you have questions about your body as a woman, questions about your mental health, questions about relationships, if you feel at times that you're broken, you're not, and you've come to the right place. I'm here with one of my best friends, lifelong best friend, Dr. Mary Catherine Nader, who has her PhD in counseling. Mary Catherine, I'm so excited we're doing this.
Me too. It's going to be fun.
What else do you see A Journey to Whole Woman Health offering, Mary Catherine?
Well, I hope it's a place where science, soul, and story can really come together, where we can understand what's really happening in people and women's lives, in their bodies and their minds, and really how we can move forward together.
Absolutely. We've both spent our careers taking care of women. We're passionate about that. That is our calling. We're really going to talk more about our callings. As an OBGYN, I take care of women of all ages, those that are experiencing pregnancy, that are on that journey, also those on the journey of infertility who want to start a family. I perform surgery for a variety of reasons. I also see and treat women going through hormonal changes. I myself am in midlife and very much experiencing these hormonal shifts that occur in perimenopause. But I'm also a wife, I'm a mother, I'm an athlete. I'm a long distance runner. I'm currently training for my 5th marathon. I was a collegiate athlete, so that's a huge part of my life as well. And all of these things have taught me about endurance, about patience, and about listening to my body.
Yes, and I'm Dr. Mary Catherine Nader. I'm a licensed professional counselor supervisor, and I also have a PhD in counselor education and supervision. My master's is actually in pastoral counseling, which is both theology and mental health. So I really like looking at the whole picture when it comes to women's health. I specialize in women's mental health. I have an EMDR certification, and I'm also certified in perinatal mental health. So I've walked with women through anxiety, depression, grief, trauma, identity shifts, all the struggles that can go unseen. Almost every day in my office, a woman says, I've never told anybody this, but mm-hmm. I'm sure you get that a lot too.
I do.
And it's such an honor to get to be that person. So I'm really excited to get to have a space where we can talk about those things that some women don't ever talk about mm-hmm. with anybody else. I'm also a pastor's wife. I'm married to my high school sweetheart that Jamie also knows, and we're all good, very close friends with husbands and wives in each other's weddings. And I'm the mother of 2 teens, so I'm also going through that transition as a mom. So really excited to get to be here and get to do this together.
Absolutely. We've talked about it for a long time. I'm a huge fan of podcasts. I listen to them any chance I get. And I think we both had this realization that we have things to offer. And a lot of times there's not enough allotted time in our visits, perhaps. There are things that go unsaid that we wish we had time or we wish we had a platform to share. And I think this is a long time coming. And I know we're going into this very much learning as we go, but also with the idea of why not us?
Right.
Why don't we do this? Let's
Sure.
figure this out.
Right.
Let's go for it.
Let's do it. We definitely have the imposter syndrome. We were laughing about it coming in, but we said, hey, here we are. We're going to just show up and we're going to see what happens and just have fun while we're doing it together.
And it doesn't have to be perfect.
It doesn't have to be perfect. We're here for a journey. So it's going to be fun.
Yeah.
We also both have sisters. We both have daughters. We both spend our careers caring for women. So we're just really passionate about these topics that we're going to be talking about and continuing to learn about these topics, even thinking about our daughters experiencing these things in the future. So it's really fun and exciting to do this.
It's important. Do you want to share more about our story and how we met?
Sure. Let's do it.
Go for it.
Okay. So my first memory is, I guess, before we started freshman high school volleyball camp.
Same.
I think that's when we first met. And I think that you came over after practice or something, and we had strawberry pie.
Yep.
My mom makes an amazing strawberry pie. And I just remember it being like, okay, we're friends. Like, this is it.
Yeah.
So many memories together all through high school, college, in each other's weddings. Husbands also in each other's weddings. Our husbands were friends since middle school. So lots of connections.
Lots of history.
Lots of history.
For sure, my memory is the same. Volleyball at Pascal High School, and we had these name tags. You remember they were on masking tape?
Yes, that's
and I
right.
remember your name tag was so long it kind of wrapped around the backside because it's Mary Catherine Segulia at the time. And you know, we both came from middle schools that weren't the big, you know, middle school that fed in to the high school.
Yes.
We kind of came from outlying middle schools.
I didn't know anybody coming in.
I knew a few people. I had definitely friends, but they weren't doing the same things that we were doing as far as sports. And so, you know, looking back, it was very much kind of this little kid moment, like, hey, you want to be my friend?
Yes, totally. That's exactly what I remember.
Yeah.
Yes.
And we hit it off. And I think our family backgrounds are very similar. The, you know, faith-based, supportive, involved families.
Yes.
And you're the oldest of 4 girls. And, you know, I think that definitely, I'm a big believer in birth order, that it really does make us who we are to some degree.
Yeah.
Would you agree with that?
For
being
sure.
the oldest
For
of 4
sure.
girls? Yeah. And then, meeting Joseph, your husband. I remember he asked you to homecoming. I was like, I didn't have any classes with him.
I remember because I didn't know anybody, so I asked you. I was like, Jamie. And I remember we were in the locker room. I remember sitting, and I remember exactly how I was facing. And it was like the coach's office was behind us. Because this guy had asked me, and I had to ask somebody, like, who is this guy? You know? And you came in, and I said, hey, this guy, Joseph Nader, just invited me to homecoming. And you had this kind of look of like, oh, no, on your face. Like, I don't know who that is. Like, I hope this guy's okay.
I was looking out for you, friend.
Of course, it ended up being fine.
Yeah, of course. He's absolutely amazing.
Yes.
And I love that our husbands are so
good
connected
friends.
and support each other.
And I remember when you were packing to go to your first kind of dance with Charlie up at West Point, and I knew that he really liked you and you didn't know yet. And I still remember sitting on your bed while you were packing up and thinking, oh, and I think I said something because you're like, well, I mean, it's just Charlie. And I said, well, Jamie, I think he kind of likes you. And I just remember your face kind of changing.
Yeah, you had the inside scoop.
I had the inside scoop.
You always have.
Trying.
And you were one of the first friends in our friend group to get married.
I was, yes.
And to have a baby. Lydia
on your birthday, which
Lydia
is so fun.
Is my birthday buddy, and I absolutely love that. So you've definitely been this trailblazer when it has come to big milestones, I think. So I love that, and I definitely respect you, and just love that we're doing this journey together. So what do you think? Why does this podcast need to exist, MK? What are we trying to accomplish? What are we going to do here?
Well, you know, I'm a big journaler, so I have it in my journal that a year ago tomorrow we had said we were going to do this podcast. So I'm so proud of us that we beat it by a day.
Yeah, we did.
But I remember we were having lunch and we just were talking about this need and how we were talking to so many of our patients about the same things, and exactly what you said. We don't always have a lot of time to go over these topics. So to be able to share with them an episode will be really helpful. And also, I remember us just saying, and still today saying on the way here, the purpose of this is so that we can have fun. We really want this to be fun. We have enough stressful things in our own lives, and then we know all of our listeners have enough stressful things in our life. So we really hope that this is a place that it's fun and informative together, that we can really grow and support one another on this journey.
Yeah, for sure. And I know people ask me, and I'm sure they ask you too, like, how do you do it all, Jamie? How do you do it all? But look, this excites me. This is not like preparing for this and even, you know, booking the space and thinking of names and thinking of episodes and what are we going to talk about. Like, it has given me such energy and excitement that I have needed that. I think that's important, that as women we have something, and it's going to look different for everybody.
Sure.
Right? You don't have to go out and start a podcast, but we are experts in what we do.
Yes.
And
Let's keep saying that to ourselves.
Yeah. I don't mean that in a prideful way, and I really hope it does not come off that way, but we truly have been in our field, in our practice, in our craft over these years, and the life experiences that we have had. I think they matter. Yeah, and at the end of the day, if it's just our moms watching this and listening
Mom.
to us, we love you, Mom.
Thanks, Mom.
Then that's okay too, because we're doing it for us.
Yes.
We're doing it for us. So what sort of topics do you think we want to tackle? What does the future look like for Journey to Whole Woman Health?
Well, we've talked about so many. I mean, we've literally texted for the past year ideas about episodes. We have so many ideas, whether we've talked about lots of mental health things like trauma, postpartum depression, midlife crisis, dealing with hormones, and perimenopause, which we're both in the throes of, dealing with motherhood things, compassion fatigue, imposter syndrome that women deal with, parenting stuff, friendships, communication.
All of it.
All the things.
All of it. From a OBGYN standpoint, there's so much, right? And I think it's really hard in this day and age to know what is reliable information. Is it reputable? Is it trustworthy? Is it evidence-based? That is going to be a big part of what we share with you. What does that even mean? Well, it means that there are good, robust studies, ideally randomized controlled trials, that support the guidance and recommendations. Unfortunately, in women's health, those don't always exist. And I'm sure we'll get to more about why that is and what is happening. I truly believe we're at the precipice of a movement in women's health. We've got some great experts out there that I definitely am learning from and listening to, like Dr. Mary Claire Haber, Dr. Amy Shaw, Dr. Rachel Rubin, to name a few, Dr. Vonda Wright. I mean, these are amazing doctors, some OBGYNs, other specialists, and they're making women's health a priority. And we're doing the same. I mean, we're not on their level yet, but...
well, I remember even just when I decided to focus on women's mental health, a few people saying, I don't know if you can build a whole practice on that. And just saying, I think there's such a need for it. I experienced postpartum depression and I wasn't able to find someone who specialized in that. Yes. And I feel like it's like going to a general practitioner versus going to like a cardiologist when you're having heart issues. Like, you want somebody who really knows what you're experiencing and how to help. So of course, we don't want to be a substitute for your personal physician or therapist, but we're going to try our best to just present the things that we know.
Absolutely. And we're not going to jump on trends. That's definitely, we may talk about them. We may shed some light. We may have some debunking. But we want to stick to truth. We want to stick to the evidence. We want to stick to guidelines, regardless of what the topic is. So definitely pregnancy, I expect us to really highlight some things that come up with all the changes of pregnancy. What a journey pregnancy is. So, but also infertility.
Yes.
And incredible journey there. We can talk about in vitro fertilization. What is it?
Right.
Who needs it? How do you know? How much does it cost? So we can really dig into the facts about those such things. PCOS is a huge topic.
Yes.
I see a lot of that in my office. Definitely relates to fertility. And then, of course, we're both in midlife. So I do anticipate that we will focus on midlife concerns, but it won't be exclusive for the perimenopausal woman.
Sure.
We want to meet the needs of all our listeners and followers. because we know you're each on your own journey and in different seasons of life.
Yeah. And if it's not helpful for you now, it might be helpful for you in the future, or you've already lived through it, but you can share it with someone who it might be helpful for that's experiencing it now.
Absolutely. Talk to me, MK, about your calling into counseling and therapy.
Sure. So I was in seminary. I actually wasn't sure exactly what I was going to study. My husband was in seminary, and I started working there at the school so I could take classes for free. And I thought, why not? So I just started taking classes and decided to do pastoral counseling, which is a combination of theology and mental health. And then I really just felt this calling to set the captives free, which is from Isaiah 61:1, which was so cool when later we were having this conversation and Jamie shared about having a calling from that same verse to bind up the brokenhearted. Just that those two go together, and we both heard that so clearly. And it's just such a neat thing to truly see that in my office every day, see how people are getting set free, whether it's from trauma, whether it's from anxiety, whether it's from depression, whether it's from unforgiveness or some sort of abuse or brokenness. It's just such a cool career to get to be in. What about you?
Absolutely. I knew from a young age I wanted to be a doctor. I didn't know what kind. I definitely had a heart for the nations and was drawn to medical mission work, and have had some really incredible moments abroad practicing medicine. I was able to join one of my attendings when I was a resident, an OBGYN resident. He went every year to Ecuador, and he always took one fourth-year resident with him to assist in surgery. And I was so blessed to be that resident and truly changed my life. And it was a hard decision because I had an almost 1-year-old. In fact, she had just turned 1. She turned 1 in December, and then we went to Ecuador in January. So she started walking when I was in Ecuador, but that's okay. Again, it just kind of shows that pull, balance. Right? And that balance. And thank goodness that I have such an amazing partner in Charlie. But so I knew medicine. And it wasn't until medical school, our clinical rotations, where you start rotating through and are able to experience all the different specialties, most of the specialties, the big ones anyway. And I started off with surgery, and I thought it was so amazing. I loved being in the OR.
I remember you saying that. Remember us being partners in anatomy? Anatomy class. I literally had to sit on the floor. Listeners, I pass out very easily. So Jamie had to do all the things for anatomy, and then she just kind of hold it up over the edge, and I was sitting on the floor because I couldn't fully stand up because I felt so sick to my stomach. And she'd just be like, "This is the heart. You see the heart? Okay, all right. That's the heart."
Yeah. We differ drastically when it comes to...
You loved surgery, and I was not surprised at all.
Yeah, we're going to have to really dig into some of your stories, MK, about your vasovagal episodes. I understand there might be one about a recent mammogram.
Oh my gosh. Yes, we can share about that at another time.
Stay tuned. Yes. Stay tuned. Fantastic.
So you loved surgery.
Loved surgery. Didn't love the idea of being a general surgeon. I wanted more focus. And so toward the end of the third year of medical school, rotated through OBGYN, and I really had that confirmation. Loved it.
Yeah.
Loved the focus of women's health. The focus of operating in the pelvis, knowing all of that anatomy very well. And I loved that continuity of care.
Yes. I remember having this conversation at La Madeleine. Do you remember this? I think it was like on Christmas break or something. You had just had, maybe it was the summer, we had breakfast together because I was living in Kentucky and was home. I don't know if you remember this.
I was so sleep deprived.
You were so exhausted, but you were telling me how excited you were and that you were going to do OB-GYN, and I was so excited for you. And then I remember telling you, but our friendship is going to stay up here. I will send all the friends and family to you, which I have.
I do remember
You've delivered lots of family members, babies, and all the fun things.
But not you.
Yeah, but not me.
That's okay.
But that was a good decision.
Yeah.
We
have boundaries.
We have boundaries. We've been good friends, and I still always consult you on all the things. But I remember how excited you were and how excited being that for you.
And it just clicked. And I knew that I wanted to just grow with my patients, and that is truly what it's been. It's been, taking care of them perhaps before they're in a long-term relationship, and then when they start their family, and then delivering multiple of their kids. That is like, that is just amazing.
So cool.
You know, there's definitely some I've delivered all their kids. There's some I've missed their deliveries here and there just because of life and call schedules. And then some I've even done their hysterectomy, you know, when needed,
Ready
when
to tie it
indicated.
all up.
Yeah. So I love that continuity of care. But I will tell you, back to your statement and really this kind of career verse that speaks to us both. I had a patient a few years ago ask me, and she actually asked this question, she and her husband both. They asked me this in pre-op before we were going to go do a DNC, a dilation and curettage procedure for a miscarriage that she had had. And so here she is at this really low point in her life, right? And they were just such a gracious couple and just so vulnerable and caring toward me as well. And they asked me, what is the most rewarding part of your job, Dr. Irwin?
Wow.
And I thought, you know, if you had asked me that 10 years ago or as a resident doctor, I think I would have had a very surface level answer of, what's delivering the babies? It's so happy.
Yeah.
It's joyful, right? And it is. Don't get me wrong.
Sure.
Like, that is an amazing, wonderful part of my job. But I will say now, after being an OBGYN for 17 years now,
Wow.
is that right?
Yeah. That's crazy.
The most rewarding part is the hard moments.
Yeah.
The hard news, having to deliver, the devastation, where you know that their life is never going to be the same after you have this conversation, whether that's telling them their baby has a lethal anomaly, or they have cancer, or what have you. But the fact that I get to step into that place.
Right. Gives me chills.
Yeah.
What an amazing place.
Because it could go really poorly.
Yeah.
And sometimes, unfortunately, it does, I think, right? And I think that's because doctors are coping and putting up walls and trying to, I guess, protect themselves, right?
Yeah.
But for me, that is the most meaningful because it is that opportunity to bind up the brokenhearted and to really, truly hold on to hope for that woman.
Yeah.
That she will see a crown of glory and beauty from ashes because she may not have any of that hope.
Right.
And I bet you feel that way too.
Yes.
You and I both get to be that person when they are completely without hope.
Yes.
We get to carry that for them.
Yeah. And who else gets to do that? I always just think I'm so honored because I think, wow, nobody else gets to hear this story. Nobody else gets to see this person process through this incredible trauma that's had such a grip on their life, you know? And I named my practice Hope Counseling. It's in Willow Park, but I see people in person and online. But the name Hope Counseling was just because, well, first of all, to myself, it was kind of a joke, like, I hope this works. I hope this wasn't a huge mistake starting this practice.
What have we done?
Right? What am I doing? And here we are again. But also on the same side, really, I was thinking, you know, everyone is looking for hope when they're dealing with this kind of stuff. They are looking for hope. And to be able to be the person who gets to be the hope bearer, hopefully, or be the one, you know, we are not the hope, God is, but to be the vessel of that, what an incredible place to be. Like, it really is such a gift that you just think. And when people ask me, how do you do that? How do you hear those stories? How do you sit through those difficult things, conversations? And I just think, you know, it's such an amazing honor to get to do that, to get to be that person.
Yeah.
It really is.
And that's the perspective you have to have. Otherwise,
it's exhausting.
Burnout.
Yeah.
Yeah. I had a similar perspective change. I had to, right? And I can remember specifically, again, another just tragic situation, a woman with a fetal demise and delivering in the hospital. So being induced into labor to deliver a baby.
And fetal demise, people might not know.
Yes. So a baby, typically, after 20 weeks. Yeah. So a stillbirth is another term we may use. So, and this was not my patient, but I was on call that night and, 2 a.m. delivery. And I think I could have very easily gone into my selfishness and been like, and I didn't want to be there.
No.
Nobody wanted to be there.
No, right.
The patient didn't want to be there.
No,
the nurse didn't want to be there. The family, the husband, nobody
wants to be in that situation.
Ever. No one should have to, right?
Yeah, it's just brokenness. Yeah.
But here we are. And I had to look at it as I'm the one chosen.
Yeah.
To be on call.
Right.
This night, this moment for her to show up.
Yeah.
Right.
Right.
And to take good care of her.
Yeah. That gives me chills.
So it's important.
It is.
Right. And keeping our mind right is just such a big part of what we do.
Yes.
Right?
Yes.
We're the ones taking care of other people, and we've got to take care of ourselves.
Which is probably hopefully something else we'll talk about on the podcast too. Compassion fatigue is something I studied with my dissertation, and we talk about all the time how important it is for us as caregivers to take care of ourselves. And we know so many women who will be listening, hopefully, to this podcast are caregivers, whether it's professionally or just at home or both. Yeah. I say just at home. At home is a big deal.
Big time.
So, yeah.
Yeah. I love it. So we've talked about our faith already, man. We just jumped right into that.
We did.
So how else do you see faith really coming alongside science, Mary Catherine?
Well, I just think the two go together, so well, because God is the creator. So, and I just feel like they're both so important in just shaping how we see things.
I agree. And we're not going to be here to tell you what to believe.
Right. Of course not.
We're not here to preach. We're speaking from our own life and our hearts, and we know what we know.
Right. What we've experienced, what we've walked through with our patients, for sure. Yeah.
And we want to create a space where truth, wisdom, and compassion coexist.
Yes.
That's what this podcast is all about.
Yeah, and being curious ourselves, learning. We hope to learn ourselves through this, learn about new things.
Oh, yeah. I get to come to therapy every time.
Right? I get to learn all the things.
So when we say journey to whole woman health, we definitely don't mean perfection.
No.
We mean understanding. We mean connection. We mean growth.
Yeah. And together. Coming together.
Yeah, absolutely. Well, good. Science, soul, and story. We want to educate, empower, and encourage. That's really the root of what we're trying to accomplish here on a journey to whole woman health.
Yes, that's right. We're excited to start.
Any closing words, Mary Catherine?
I'm just excited. I think it's going to be so much fun. I'm just honored that we get to do this together. What a cool gift. And, again, even if it's just us doing it just for fun for ourselves, it's totally worth it.
We're all in.
We're in.
Thanks for joining us today. This has been the first episode, A Journey to Whole Woman Health. Thanks for listening.
Thank you for joining us on A Journey to Whole Woman Health. If this episode encouraged you, share it with a friend, leave a review, or subscribe so you don't miss future conversations. Remember, your questions matter, your health matters, and wholeness is a journey. Until next time.
Now for the legal language. This podcast is for educational and informational purposes only, and is not intended as medical, mental health, or professional advice. The information shared on A Journey to Whole Woman Health is not a substitute for individualized care, diagnosis, or treatment from your own physician, mental health provider, or qualified healthcare professional. Always seek the advice of your personal healthcare provider regarding any medical or mental health concerns. Never disregard a delay seeking professional care because of something you heard in this podcast.